Hi, I'm Renee Franklin, student at University of District Columbia. My course study is Foundation of Ethics. Instructor is Professor Stanberry. And I want to do a synopsis on a case study of autonomy. So there's a woman that has a condition. It's a medical condition of abdominal aortic aneurysm. This woman has decided that she does not want to have a surgery because of her profession. She feels that the surgery would leave a scar, so she is denying or not giving consent to have this surgery. Her physician, however, is trying to explain to her that this surgery is absolutely necessary because if the aneurysm bursts, it can cause death within minutes. However, she insists and she refuses to have the surgery. The doctor, however, decides that he's going to do the surgery, and he does. The surgery is successful. However, autonomy, this woman has autonomy, and it's the right of or condition of self-governing. This is an adult woman with a sound mind, and she has the right to make a decision concerning her own body. Any medical attention that she does or does not want to receive is based on her decision. So this doctor, however, is adamant about doing this study, doing this surgery, and he does so without the woman's consent. And the woman, in turn, it was a successful surgery, but she sued the hospital for millions. Now, does the doctor have a right to enforce his opinion on this woman? Absolutely not. The doctor should have, the objective of this study is to show what's right, your a woman's or your medical rights versus the physician's medical advice. So this doctor is acting in what is known as a priestly mode. He feels as though he has superiority to make the decision for this woman's life based on his medical knowledge. He has superior medical knowledge, and he decides that this is what he wants to do and this is what he's going to do. And so he performs this surgery on this patient, and it wasn't a good thing because she was very upset. So what he should have done was acted in his role as a priestly model and did no harm. The priestly model says that a physician has a moral obligation to act in a priestly model of benefit and do no harm to the patient. Now, was it a benefit? In his eyes, it was. Did he do harm? Yes, he did harm because he illegally went above this woman's right to not have the surgery, and he decided on his own that yes, this is what he was going to do. And so, in my opinion and in conclusion, any adult with a sound mind, any adult with a sound mind can make a decision on whether they want to have a surgery or whether they do not want to have a surgery. They should not be pressured. They should not be forced. It's their legal right to do what they will or won't do. And as for the doctor, I think he overstepped his bounds. He, went on and did the surgery. I know his intent was probably good because as a physician, you want the best for your patient. Your Hippocratic oath is to serve the patient and, take care of the patient to the best of your medical knowledge and ability. But he went over his bounds by illegally performing a surgery on a patient without the patient's consent. So that's my conclusion, and that's my spill on this issue with autonomy and the patient's right to make a decision concerning his or her own medical attention. Thank you so much for your time. Bye.